Good evening and namaskar. Today, I am in awe with the collected expertise gathered here. Many of you have made a huge effort in joining us in the webinar today, especially during the current pandemic time when every doctor is busy treating the patients and being in the front line to serve the nation. So, on behalf of Mayor Vita Biotics, I thank you all and I am deeply honored to welcome you to the first webinar of the Wellness Renaissance series. The world has actually changed dramatically since the COVID 19 pandemic has begun. In addition to our social, occupational, and personal lives, the new routine posed novel challenges to our health and vitality. 2020 has been a year full of challenges and thereby forcing people to adapt to new realities. The first challenge, the rising number of COVID cases across India. And the second challenge, the COVID vaccination running out of stock. With the rising challenges, the importance of immunity has gained utmost attention. But in order to maintain the immunity, it is important to have an adequate nutritional diet. As per the recent research, it has been found that proper nutrient supplementation is necessary to support the COVID-19 vaccine efficacy. I, Mr. Rohan Datta of Mayor Vita Biotics, on behalf of my organization, I am pleased to welcome and thank all the delegates who have registered and are attending this webinar with us today. Mayor Vita Biotics is the global business partner of Vita Biotics UK, headquartered in London, which is UK's number one and the world's fastest growing nutraceutical company. Dr. Kartar Singh Lalwani is the founder and chairman of Vita Biotics. He is a bioscience inventor who has successfully commercialized his own inventions. Mayor Vita Biotics is one of the leading pharmaceutical manufacturers of India. Mayor has created a unique portfolio of products for addressing the needs of men and women of all ages. During this pandemic, in order to strengthen and boost the immunity, Mayor offers the best nutraceutical and nutritional supplements in the form of the wellness range. That is, Wellman and Wellwoman for men and women of all ages. Wellman is UK's number one health supplement, which contains vital antioxidants, micronutrients, essential amino acids, which are necessary for the general well-being and vitality of men. Whereas for women, we have another product in the basket, that is the Wellwoman range. The Wellwoman contains evening primrose oil and starflower oil, which is scientifically designed for indications such as PMS, mastalgia, as an adjuvant in oral contraceptives and endometriosis. Wellwoman aptly provides an all-round nutrition for women and restores well-being in women. So today, Mayor Vita Biotics provides a unique platform to connect, engage, and create an avenue towards robust exchange of information on the role of micronutrients in enhancing efficacy of COVID-19 vaccination under the guidance of the leading and eminent speaker, Dr. Mangesh Tewaskar, and on the topic, role of micronutrients in enhancing general women's health and COVID conditions under the guidance of Dr. Vidya Thobi. I would like to extend my warm welcome and express my sincere gratitude to Dr. Mangesh Tewaskar. Dr. Mangesh has been awarded as the gold medalist in Doctor of Medicine, along with his MBBS degree in biochemistry, pathology, microbiology, and pharmacology, alongside a diploma degree in advanced diabetology from Denmark. Dr. Mangesh is currently the Honorary General Secretary of National API, ICP, and PRPF. Dr. Mangesh has delivered more than 1,000 lectures in national and international conferences and has multiple chapters, publications, poster presentations, write-ups in textbooks, and peer-reviewed journals and international platforms. Moving ahead, I would also like to extend My warm regards and greetings and salutation to our next speaker of the wellness webinar, Dr. Vidya Thobi. Dr. Vidya is the professor and unit head of Department of Obstetrics and Gynecology at Al Amin Medical College in Vijaypur, Karnataka. She has been the chairperson of Food and Drugs and Medico Surgical Equipments Committee at FOGC during the period of 2018 to 2020. And during this era, she has received the FOGC Champion Award in 2019. She has presented numerous papers at national and international conferences and organized various CNEs and awareness programs, alongside which she has been a postgraduate and undergraduate teacher for the last 30 years. So, without much further ado, we can start our scientific discussion. We are really looking forward to hearing and learning from our distinguished guests and dignitaries about their experiences and sharing their ideas. So I would request Dr. Mangesh Tiwaskar to commence the session.
Thank you, Rohan. Thank you very much for
Thank you
this
so much.
wonderful opportunity. Good afternoon, friends, and thank you very much, the entire team here, for this nice opportunity and the beautiful, I would say, time that I'm going to have with all of you. And of course, it's an honor and a privilege to share my dais with Vidya ma'am, one of the key Foxy members. Minal, if you remember, we did a program with Foxy in the anemia eradication, or SATSAT program, I believe it was, right? And
Yes, sir.
and I think that that was one of the superb ideas of the entire Foxy team, along with your team. So thank you very much, and
Thank you,
of
sir.
course, thank you every one of you those who have joined and spared your Friday afternoons with us in this time, which is really testing and challenging. In this time, which is really testing our patience. This time, which is actually examining your abilities of being not only the good doctor or a clinician, but testing everybody's abilities of being a human. This is the time when we discuss about the role of micronutrients. And as Rohan has rightly pointed out, that with all the, I would say, uh, adversities that we have, like we are running out of the drugs, we are running out of oxygen, lifeline, we are running out of the beds, we are running out of the manpower. Now, in that, probably the best thing that we must do rather than finger pointing or shedding or shrugging off the responsibilities is to own the responsibility that yes, it will be I or me or we as a, as a citizen of this country, this great country led by our great Prime Minister. Let us understand our own responsibility. And one such responsibility that we all have to understand is to accept the importance of the immunity and how important it is to preserve this immunity in this current pandemic. One of the reasons why I keep on saying this to each of my patients is this, that because I always talk to people saying that there are only two things which cannot be stolen from a human being. The rest all things will either leave you or can be robbed or stolen from you. The first thing which cannot be stolen from you or robbed out from you is your education. So be well educated. And the second thing which cannot be stolen and robbed off from you is your health. People used to also talk about the prestige, but now according to me, the prestige has no value these days. But probably these two things are still pivotal for the human as to be a successful human being. So respect your health. That is your own treasure. And one of the ways to address this treacherous challenge, that the preservation, is to understand the role of micronutrients and its importance, especially in this period when we are actually in this COVID pandemic. Of course, we know the best way to prevent this and the best way to stop the onslaught or this mayhem, or I would say, the entire, I would say, chaos which is on, is a good vaccination program. And there are multiple vaccines which are there. We have Covishield, we have Covaxin, we have got Bharat Biotech giving us this Covishield. We have Moderna coming up to us. Sputnik has already arrived from Gamaleya. AstraZeneca vaccine, we already are using it. But remember that this is one area which is adequately will be effective, provided their support system to this vaccine is also effective. We are aware about that, that non-communicable diseases are deciding times in this generation, I would say, or last probably I would say a century or so. But before this, probably last 5 decades or 6 decades, the most I would say talked about causes of morbidity and mortality were communicable disease. Probably 20, 25 years ago, if you would have been attending an Association of Physicians of India or a FOXI conference, there would be sessions which would be talking to you about management of the infection. But now we do not talk about it because we are in the era of non-communicable diseases. So this is how we are seeing or witnessing the epidemiological transition or change of epidemiological situation. But then remember that elderly population, especially in our country, has been always, I would say, the people, those who are especially are what we call it as immunodeficient, and primarily because of this immunodeficiency which comes to them because of the age or the associated comorbid condition, that reduces the effectiveness of the vaccine. So this immunodeficiency in the elderly or in overall, I would say, is called as the immunosenescence. So immunosenescence is the term which is used for the altered immune response. And vaccination is a very, very important way to actually better this immunosenescence. And if you have something to additionally support this immunosenescence or the down regulation of the immunity, because of the so many factors which can contribute, which I'm going to talk to you about, the modulation of both innate and adaptive immunity, which actually is extremely important for the, I would say, alteration of the response to the microorganisms, decides the outcome of the disease. Now, this is what we call it as immunosenescence or immunodehiscence, I would say. Is this that the age is the part, is the factor. But apart from that, what are the factors which actually will impact? Is number one is obesity, presence of the comorbid disease like diabetes, hypertension, dyslipidemia. We all know that with the growing age, there is a gut dysbiosis. So the gut microbiome, which is a primary barrier and is one of the very, very potent part of our immune system, gets disrupted. There are dysregulated immune responses. Then addition, in old age, you are sleep deprived. In addition, in old age, your regeneration or recovering power for the various cell series goes down. So you do not have adequate immune cells to support to your situation. At the same time, there is a endocrine dysfunction, especially thymic dysfunction, which is very, very important for actually the training of the T cells. We all know that thymus is a school for the T cells. Thymus is a school for the adaptive immune response. In thymus, the T cells are trained. T cells are classified. T cells are subclassified into different types of helper or cytotoxic T cells. Now that thymus dysfunction occurs with the advancing age. And to add to it, if there are comorbidities, there is a chronic inflammation which is setting, which will ultimately reduce down an immune response to the immune triggering factors like vaccination. So we all need to understand that old age or additional comorbidities are the contributing factor for the limited response to the vaccination program. It's very important for us to understand this. And that is the reason why primarily Food and Agriculture Organization of United States have come out with a statement that in India, around 200 million people are undernourished. But I probably tend to not agree to this statement. I would say, okay, fairly fine. We have 200 million people, those are undernourished. But do you know how many of are overnourished? In fact, I'll say that not just being undernourished, but being overnourished with the wrong kind of a food content also alters the response of the immune system and also alters the response of immune system to the immune triggering mechanisms like vaccination. So it's just not like a nutritional deficiency or age. It is the nutritional extravaganza which is happening, which is also contributing to what we overall call it as malnourished. So purely malnourishment does not mean undernutrition. Remember, malnourishment is also equally bad over nutrition, which is, I would say, useless nutrition that our body has to deal with, which will ultimately lead to an immune down regulation or immunodehiscence, and which will lead to the reduction in the response to the vaccination. So not only the proper diet, but the proper micronutrient supplements decides the immune response in overall population. In fact, I can tell you that the vitamins like vitamin C, vitamin E, vitamin B complex, various vitamin A, micronutrients or the micro minerals like zinc, selenium, iron, copper, these are all very, very important as a part of the immune response team. And the European Food Safety Authority has adequately come out with the guidance that these nutrients or these nutraceuticals have to be also adequately addressed when you are treating the patients for any kind of infection, and especially in the COVID times, it becomes extremely important. Now we know that influenza vaccine has to be taken every year, apart from the viruses getting mutated or the different strains are coming. But one of the reasons why effectivity of the influenza vaccine is not as good as the any other vaccine in our country is primarily because of these immunodeficiencies occurring not only in the elderly but in the overall population of the Indian subcontinent or South Asian subcontinent. So poor nutritional health is one of the most important factors for the poor immune response. So, how do you enhance this? The best clinical evidence that we have, which can actually show that a good nutritional treatment or a good supportive micronutrient replacement therapy can improve the effectivity of the vaccine. And there are so many. Ginseng, I am not the authority, I am not trained, but there are quite a few Korean and Japanese publications those have come in favor of ginseng, which has shown that, especially in the influenza epidemics, ginseng has shown or has proved the effectivity of better handling of the respiratory insults in compared to the vaccinated in comparison to the vaccinated people to the non-vaccinated people. Ginseng extract has been shown to take care of your fatigue, your malaise, apart from the better immune response. But vitamin D, well established fact, and this was so beautifully established in the swine flu epidemic. Vitamin D importance is not only important just in the chronic non-communicable diseases, but vitamin D supplementation is also beautifully insisted in this outcomes of the COVID pandemic currently. And especially even there are some publications which have come even from India that in the intensively critically ill patients, an adequate vitamin D supplementation might actually augment the recovery period. Vitamin A, we all know that it actually addresses the better behavior of the respiratory defense mechanisms against the bovine coronaviruses. So vitamin A, vitamin D has got an adequate evidence. Selenium, of course, we all know that apart from the, the, the improvement in the immune response, selenium has got a role to play, important role in controlling the mutations of the bugs also. So that is a very, very important mechanism by which the selenium is effective. Vitamin C is absolutely outstandingly beautiful. I'm going to spend a couple of slides in my subsequent 2-3 minutes on the importance of vitamin C. Apart from addressing the oxidative stress, remember that it modulates both innate immune response and the adaptive immune response. Friends, we all know that innate immune response is the immunity. Innate immunity is the immunity which we are born with. If you split the term in and net, you'll realize that in, that means you are born with, net is from the birth. So the immunity which is inside you since birth is innate immunity. And what are the cells of the innate immunity that you know? The cells of the innate immunity are all the granulocytes. The cells of the innate immunity are few of the T lymphocytes, the sum of the natural killer cells, the sum of the podocytes. And then as you grow up, as you start taking your first breath, and as your antigen knowledge of the body starts going up, you start developing an antigen responses to antibody responses and the various immune responses to various antigens and the offenders of the like microorganisms. And that's how you develop an immunity which is called as an adaptive immunity. Now we know that adaptive immunity is of two types. Number one is what we know as a cell mediated immunity, which is offered or conferred by cells. Primarily cell lines are very important. T cell line, the lymphocytic T cell line, which T cells which are usually broadly of two types, helper T cells and killer T cells or cytotoxic T cells, CD4 and CD8. There are different other cells. I'm not going to go into the details about it. And then you have got a B cell response or a plasma cell. So plasma cells will I actually synthesize or manufacture the antibodies. And this immunity, which is conferred to you by antibodies, is called as humoral immunity. That means these antibodies, which are there present in the fluid, which will confer you an adaptive immunity, which is called as a humoral immunity. So this is overall about the immune responses. Vitamin C plays a role in the better response by innate as well as adaptive immunity. Zinc has got role to play to improve phagocytosis. Zinc plays a role to play in reduction in the insulin resistance. Zinc plays a role to play in correction of the dysglycemia. Zinc plays a role to reduce down the reactive oxygen species, similarly to vitamin C. And zinc also plays a role along with vitamin C. See, vitamin C is again very important for the recycling of vitamin E, which is responsible for a normal gut microbiota function. So there are so many things which are important. This is what the slide shows, that vitamin C and its role in the innate immunity. Now look at this. Along with the antioxidant effect, it improves and enhances the motility and chemotaxis. It improves the phagocytosis and it improves the response of oxygen species generation. Now remember that oxidation is extremely important for killing of the microbes. So vitamin C plays a role in triggering the reactive oxygen species. It enhances the microbial killing by improving the apoptosis and its clearance. It also reduces down the cellular apoptosis, and its help in the adaptive immunity is this, that it enhances the differentiation between the T cells and the B cell lymphocytes. It improves the sensation, the effectiveness of the T cells and the B cells. It enhances the antibody production by the plasma cells or B cells. It improves the cytokine production. And remember that in COVID times, you all know that this is this dysregulated cytokine regulation, or what we call it as, rather than calling it as a cytokine storm, I love to call it as dysregulated immune response. Vitamin C plays a role, and that is the reason why almost all the prescriptions now, if you see, of the physicians or the pulmonologists, will have an adequate vitamin C replaced there or put in there. Same is with vitamin B6, B12, and the entire fraternity. Chromium also is equally important, especially in the patients, those who are aiming to get vaccinated. Most important thing, iron adequacy is also equally important. But remember that in a COVID times, especially when the patient has an active COVID infection, and if the patient has an iron deficiency anemia, please first treat COVID and then try to treat iron deficiency anemia, because sometimes the elemental iron which is available for the therapy is responsible for the flared up immune response. So be very careful. In an active COVID, do not do any kind of iron supplementation. Allow that COVID, allow that inflammation to settle down, treat the bug first, and then go for the anemia correction. Probably micro iron therapy, which is going to come, or microparticle iron therapy, which is new area of work, maybe possibly be beneficial to correct anemia with an acute severe COVID infection, especially in ICU. So these are all overall the table of recommended dietary allowances of all the micronutrients apart from the proteins and carbohydrates. These are all important. We need to address this effectively. So if I have to conclude, I'll say that in this pandemic state, where every one of us is struggling, the only ray of hope which is going to be conferred to all of us is by vaccination, and an effective vaccination. So if you want your vaccine to be effective, you should treat the micronutrient deficiencies effectively, equally, and with the equal gravity as you write down your any other medical treatment protocols. Friends, I think I have addressed the importance of micronutrients during this COVID times, and especially in the vaccination time. I'd be very happy to answer any of your questions if at all I have not confused you adequately. Thank you very much once again to Mayor, and of course the entire team of I would say Science Integra, along with Neenal and Rohan. Thank you very much.
Thank you so much, sir, for enlightening us with your view on the topic of how important the micronutrients are in our day-to-day lives, and especially to boost the immunity during the COVID era and also during the vaccine efficacy. So now, sir, I would like to request Dr. Vidya Thobi to enlighten us with all her clinical knowledge she possesses on the role of micronutrients in enhancing general women's health and COVID conditions.
Thank you very much.
Good evening, madam.
I think I am. Yeah, good evening. Good evening. So, my slides. My slides are very primitive slides, and those include some of the slides which I had presented for the basic knowledge of micronutrients in women's health. So, please enable me to share my slides. Are you able to see my slides?
Yes, ma'am, pretty visible, ma'am.
Yeah. So my net is slightly unstable. So I would like to, in between, I may close my video. Yeah. So let us talk something about the balanced nutrition. So what is this balanced nutrition for the balanced life? And mainly the micronutrients, what we are talking about. So thanks, Mayor Pharma and Science Integra for giving me the opportunity to talk about this basic nutrition. And I bring greetings from Food, Drugs and Medical Surgical Equipment Committee of FOXY. So basically, nutrition is what we say is a human need, a prerequisite to a healthy life. So everything revolves around our nutrition, and even WHO says that the nutrition is the intake of food, right? So it is considered in the relation to the body's dietary needs. So good nutrition, what is a good nutrition then? It is an adequate, well combined with regular physical activity, which is a cornerstone of good health. And as Dr. Mangesh Tivaskar has rightly pointed out, that poorly nutrition may lead to reduced immunity, and we see the consequences of this reduced immunity, and it also leads to the increased susceptibility to the disease, impaired physical and mental development, and reduced productivity. So mainly it is a food consumption. It is always depends on the production, your socio-economic status, as well as the culture and your taboos. So it all depends on these are the determinants of our nutrition. And the RDAs are the nutrient centered and technical, and food provides nutrients and non-nutrients phytochemicals, which are the positive impact on the health. So always we talk of food safety also, and the other content of the food, which also is the determinant of our health. So people, they consume food, hence the emphasis has shifted from the nutrient orientation to the food-based approach, promoting the concept of nutritionally adequate diets, healthy lifestyle from the conception to the old age. And our FIGO, that is the International Federation of Gynecology and Obstetrics, there are recommendations on adolescent, preconception and maternal nutrition, and we all say that think nutrition first. So whenever we think of central role of nutrition in the determination of health across the life course, across the generation of a woman, and all women, it is all connected by the effect of the good and poor nutrition. So poor nutrition at any stage has got negative consequences, the life and impact at the later life, including future generations. So whatever nutrition is there, it is a transgenerational effect we see. So if we see here infant and child health, if the nutrition is affected, it causes the stunting, poor cognitive development, acute and chronic diseases. Adolescent health gives us very poor school performance, impaired reproductive health, and chronic diseases. And in women's health and human capital also is affected by the women's nutrition. It also affects during pregnancy and nutrition. Nutrition affects during lactation. It decreases the work capacity as well as the family care, and increase maternal, neonatal morbidity and mortality. And all these are again are determined by social and environmental factors. We all definitely know about the fetal origin of the adult diseases, and it is now widely accepted that whatever risk of number of chronic diseases in adulthood, such as diabetes, hypertension, or all non-communicable diseases, they have origins before birth. So whatever the maternal environment, maternal placental physiology does affect the fetal environment, intrauterine environment, and the whole placental unit. It has got the genomic effect also, and it leads to the alteration of the fetal growth and interaction of pre and postnatal environment, and this is the reason for the fetal origin of the disease. Now, this is just a conceptual for how the maternal diet and micronutrient status may affect the development of chronic disease in the offspring. Why we are worried about the maternal micronutrient deficiencies? It has got effect on the epigenetic gene regulation. Various deficiencies lead to the restricted fetal growth and development. It has got a direct effect on the primary functions, on vitamins, various vitamins. Also, it has got a various results of that. It results into the various allergies, then respiratory infections, reduced lung capacity. All these things are because of again the micronutrient deficiencies. It has got end organ damages on renal function, cardiovascular function, pancreatic cell functions, body compositions, which lead to various diseases like hypertension and cardiometabolic risk. So everything revolves under the nutrient deficiencies. So these nutritional interventions, whenever we are seeing into the interventions, they should start very, very early. Actually, we say adolescent period only, but preconceptionally, it has got very means if you start like folic acid, vitamin B12, vitamin D, and iron, iodine. These are the critical period of the development of the embryo, fetal organs, and tissues. And the intervention should start from the preconception, from then first trimester, then second and third trimester, and breastfeeding. There are various molecules, various micronutrients, various trace elements. They are very, very essential for the development of the embryo, as well as even in the post delivery for the maternal prevention of the various maternal diseases. So there are general issues like age at conception, energy balance, obesity, chronic diseases, infectious diseases, risk management we should consider. Now about the balanced diet and the food groups. Whenever we talk of balanced diet, it should provide all the nutrients in required amounts and proportions. It should be easily achieved by the blend of 4 basic groups we always talk of. And the quantity should vary according to the age, gender, physiological status, and the physical activity. So we always call macronutrients and micronutrients. And macronutrients, we know that carbohydrates, 50 to 60% of the calories should come from carbohydrates, 10 to 15% from the proteins, 20 to 30% from visible and invisible fat and other non-nutrients. These are the caloric requirements, and always we call it as a Anna Hai Purna Brahma. So we have various, if you take the food plate, it should have a different varieties of the food at the different proportions. So these proportions we call it as a food pyramid, and it should also have a 3 like we should have a cereals, we can consume adequately, vegetables and other things eat liberally, proteins eat moderately, and fats eat sparingly. Also exercise regularly and be physical active. And we all know that the importance of the various diet at the different stages of life. So we at toddler, we may require the energy rich foods, and as the age advances of nutrients at different levels, means at reproductive, childbearing, and rearing. So these we all know. And the classification according to the function, this also classification we are well versed. Like some are the energy rich foods, which are which are mainly the carbohydrates and fats. Bodybuilding foods, those are proteins, and protective foods are the vitamins and minerals. So we are talking today about the micronutrients, and these are the four groups of foods from which we draw our energy. What is the current scenario in India? The 18% of the pregnant woman they consume 50% of the calories, 34% they consume less than 50% of the proteins, 85% of the pregnant women consume less than 50% of iron so that they're anemic, and 57% of the pregnant women consume less than 50% of the beta carotenes and others relative to their recommended daily allowance. So, what is malnutrition? As Dr. Tivaskar was telling, that malnutrition refers not only an inadequate intake of macronutrients, but also inadequate intake of increased losses of single or multiple vitamins and minerals. So, there is a micronutrient malnutrition such that the body's requirements are not met. So, here you can see that this is a malnutrition. So, this is very common in our all generations nowadays. Malnutrition can also result from overconsumption of non-nutritive and underconsumption of nutrient-dense foods. So good diet is more than a matter of food quantity. So quality is critical. So what you very important. And always we talk of oxidative stress. So it is an imbalance between the reactive oxygen species and ability of the biological system to neutralize free radicals. So there are various antioxidants which are there. So that there is a balance of these reactive oxygen species and the antioxidant. So it is lost in some of the disease process. So pregnancy, we always call it as an increased level of oxidative stress, and there is always increased reliance on the antioxidant proteins. So there is so much literature which is available that how the pregnancy and these reactive oxygen species and oxidative stress gives a adverse pregnancy outcome. Like we get many cases of abortions, gestational diabetes, then preterm births, and fetal growth restriction. Always we talk of this oxidative stress. And what about in the older woman? In older woman also these antioxidants, they play a very important role, and they also reduce the burden of various chronic diseases and non-communicable diseases. There are various literature and various researches are available where lutein which is a carotenoid, which has got anti-inflammatory properties. It has got several beneficial effects, like it may benefit the eye health, then it improves the cognitive function, decreases the risk of cancer, and improves the measurement of the measures of the cardiovascular health. Of course, the physicians are the better persons to comment on this, but they say that lutein is a supplementation reduce the biomarkers of cardiovascular risk by reducing the lipid peroxidation and inflammatory response by increasing the plasma lutein capacities. So in old age, various antioxidant supplementation may help. So supplementation of these luteins and green tea extracts and various carotenoids, they can alter overall antioxidant status and oxidative stress. Now what about the fertility? They say that various micronutrients are very, very important for the oocyte quality, like folates and even zinc. It has been implicated in the ovulation and the menstrual cycle. Vitamin A is another important micronutrient, which is very important for the oocyte quality and the blastogenesis. Whenever we talk of DNA synthesis, which is a very fundamental for the development of oocyte, is also dependent on the zinc and certain B complex vitamins. Apoptosis is very essential for the regulation of follicle atresia, degeneration of the corpus luteum, and endometrial shedding, and is influenced by folate and zinc. The risk of the luteal phase deficiency, where inadequate progesterone secretion by the corpus luteum makes the endometrium less receptive for implantation, and so it may be increased in women with inadequate selenium levels, putting them at a greater risk of infertility. So zinc, vitamin A, folic acid, various vitamin B complexes, and selenium. These are the very important nutrients which are required for the enhancement of female fertility. Now, the vitamin D is most talked vitamin nowadays, and vitamin D receptors are distributed throughout reproductive tissues, and it has got an important role in vitamin B factors. So, folates, vitamin, one more addition. So, folate, vitamin B6, B12, D, and iron all have roles in mechanism that could affect the fertility, including the homocysteine metabolism, inflammation, oxidative stress, and embryogenesis. So ultimately, this is a definition of micronutrients. Micronutrient is an umbrella term which is used to represent essential vitamins and minerals which are required from the diet to sustain virtually all normal cellular molecular functions. And it does affect the cell signaling, motility, proliferation, differentiation, and apoptosis that regulate tissue growth, function, and homeostasis. And ultimately, as Dr. Devaskar has pointed out, it does affect our immunity level. So this is very important thing everybody should know, that how is the importance of micronutrients. And when we talk of reproductive age, especially we are talking of low and middle income countries where we know that our diet is definitely deficient in these micronutrients. And whenever there is a stress of any disease or any like pregnancy and a disease anywhere, so there are increased demands leading to potentially adverse effects on the mother as well as fetus. So what is the prevalence of these multiple micronutrient deficiencies? They say that around 2 billion people, the majority are women and young children, they are micronutrient deficient. Even there are concurrent deficiency of more than 2 micronutrients. Now, if you consider various diseases or any syndromes in reproductive adolescent as well as in menopausal woman, most commonly we come across is the premenstrual syndrome. So several essential nutrients have been shown to affect the woman's health throughout different life stages. So 75% of the women of reproductive age, they suffer from this premenstrual syndrome. So it affects a vast majority, and various supplementation, if you think of micronutrients like zinc, they have supplemented with calcium. It significantly reduces the physical and emotional symptom. This PMS, in fact, may be a predictor of osteoporosis induced by low calcium intake. There are many studies which are available, and they say that whenever the woman suffers of premenstrual syndrome, definitely there is some calcium deficiency and you have to supplement. 20 to 40% of them, they have psychological and physical bothersome symptoms. They have insomnia, they have breast tenderness, they have pelvic pain, poor concentration, confusion, anxiety, and depression. And there are ovulation and ovulation related processes which trigger the PMS related anxiety and depression. So psychological PMS symptoms may indicate underlying psychological disorders also. And sometimes we have to consult psychiatrist or counseling may be required in these patients. So there are various studies which are available, and you can just go through that. They say that these are the nutritional interventions, and they have found that they're very effectively treated this PMS. Like they have treated with evening primrose oil and PMS symptoms they have studied. And these capsules in last half of the menstrual cycle, they showed that significantly decrease in irritability, depression, anxiety, and fatigue. Okay, and even selenium supplementation for 5 weeks daily was associated with the greater elevation of mood and reduction in anxiety levels. So selenium and primrose oil was very effective in these patients. Then vitamin D and vitamin E supplementation also significantly improved the physical symptoms of premenstrual syndrome, and they were treated, and it has also caused the reduction of anxiety and depression related symptoms of PMS. Now, vitamin B6 and various other minerals like zinc and copper. So, vitamin B6 is also beneficial in the treatment of PMS symptoms. Vitamin B6 also has got a effect on the depression, irritability, and fatigue, which is associated with PMS. So, So these are the various interventions they did for 6 months. Then they have studied with only primrose oil or star flower oil. Then even they have treated with the combinations, and they have found that the cyclical myalgia, then other symptoms, they were statistically significant. There was a statistically significant reduction in the total scores of PMS assessment. So these are very, very useful interventions in PMS. Now, whenever we are talking about in pregnancy is also a stressful condition, and then they found out that if we give the micronutrients at the right time. If you see here, the blue one is a vitamin and the little pink one is a mineral. So if you have done the interventions like various vitamins like B complex and folic acid periconceptionally, and they have studied the epigenetic effects during implantation, vitamin D, folic acid, E, selenium, zinc, everything. Then the placental factors, they found that there is a effect on the vascularization, hormone production, even the nutrient transfer regulation. And in the offspring, definitely there is an effect on the morphogenesis, organogenesis, neurological development because of these nutrients, and tissue deposition and body composition. So if you see here, the blastogenesis, embryogenesis, and the fetal development at the right time, right micronutrient interventions, they have helped them. Sorry. And there are adverse health outcome of this gestational micronutrient deficiency. So it affirms that if you give this nutrition at the proper time, definitely it helps. So short-term consequences like abortion, stillbirth, birth defects, small size for gestational age, preterm birth, and the long-term are the altered growth, body composition, compromise. We know that the NCDs are common in this. And most important is the poor neurodevelopment and cognition. These are the effects of the various micronutrient deficiencies. So we must give some periconceptional supplementation. It does reduce the risk of serious birth defects, as we know of the folic acid and others, preterm deliveries like omega-3 fatty acids, if you supplement, low birth weight by 50%, and improve maternal health during pregnancy. We know the prevention of preeclampsia by giving calcium, 2 gram calcium in the second trimester, start the interventions. And micronutrients particularly are the interventional micronutrients. Remember that the folic acid, zinc, and iron. So preterm delivery, preeclampsia, even WHO says that the calcium supplementation and even the high dosages of vitamin C and E, it does significantly reduces this risk. So preeclampsia prevention is another thing one should always remember when we are doing these micronutrient interventions. So there are very well-controlled studies consistently have shown that whenever we are giving calcium supplementation with or without vitamin D, significantly reduces the risk of hip fractures, in addition to supplementation of vitamin C and E. So we know that whenever we study the BMD, bone mineral density in the postmenopausal woman, so we always supplement them calcium. But this calcium supplementation should not be after already when the damage has occurred. So the calcium supplementation, they say that it should start very early in life. So this is very important to learn. As rapidly growing embryo, when we say about the embryo, the immune system includes the rapidly multiplying cells, so whose functions are dramatically affected by individuals' micronutrient status. So already the mother is deficient in some micronutrients, and after the damage has occurred, there is no point in supplementation of these micronutrients. For example, we always say that folic acid supplementation should start 2 months early or periconceptionally, because we know that neural tube closes at around 21 days. So multivitamins have been shown to enhance many aspects of immune response, and antioxidant micronutrients consistently have been found to enhance the lymphocyte proliferative response, especially in the elderly. So from womb to tomb, what we say that micronutrients are very, very important. And the most important is a perinatal period, which we call as a brain time. It is always a window of opportunity for the nutritional optimization of brain development and future health and performance. So, what are the risk factors for the micronutrient deficiencies in pregnancy? Additional demands during pregnancies. And we must know about the differences between vitamins and minerals. Vitamins are the organic compounds which are obtained from the plants and animals. So, this vitamins and whereas minerals are the elements that are originated from the earth and cannot be made by the living organisms. Vitamins are needed to supplement when we are not getting adequate levels from our diet, so it has to be supplemented. And whereas minerals are obtained from the soil and water, so if the soil and water is healthy, we should not need any supplementation. So many of the minerals we get from our soil and these things. Whenever I talk on vitamin deficiency, this has been evolved and since the vitamins were first discovered. We have got a concept that every time we have to supplement from the vitamins. Gross vitamin deficiency may be recognized by obvious clinical syndromes, and these syndromes are still seen in areas of world with poor diets. So in our, we can see the scurvy. I have not seen scurvy since many days, but earlier, whenever in my postgraduate days, we have seen 1 or 2 cases. So that one should remember. So, and secondly, there is a insufficient information about the optimum levels of vitamins, what the patients are consuming. Many times they are consuming over the counter. Okay, there is lack of evidence that vitamin supplementation can prevent the disease in most healthy adults with low blood levels of vitamins. So many times this vitamin A, especially if you give more than 10,000 units in the first trimester, it does cause the birth defects. So these things the people should be made aware. Okay, so the specific vitamins where there is a stress factor or they are required, one should prescribe. We always tell that all vitamins are needed in the body, but some vitamins may not be needed. Some vitamins are really needed. Some vitamins and minerals are needed for our immunity development. Okay. Then what about the trace elements? The chemical micronutrients which are required in the minute quantity existing in the natural environment in the small amount. So it also has a role for the maintenance of integrity of various physiological and metabolic processes. And the deficiency may be apparent as these are required for these trace elements are required in many enzymatic processes in our body. Like zinc is required, then copper is required, selenium is required. These are required for the various, and that's why they are called as metalloenzymes. Now, few of the micronutrients are we really neglecting? Like we are always talking of iron, folic acid, vitamin B, then calcium and vitamin D3. And some of them we never talk, like copper, zinc, magnesium. Of course, iodine we do talk, but these upper three we never talk. So which are the essential micronutrients that can affect the immune status? Already Dr. Tivaskar has made my talk very easy. We know about the zinc. Zinc is an antioxidant, immune regulation. It causes the immune, it is very effective. And always we are talking in our COVID treatment that you take adequate amount of zinc. Then selenium also plays a role in the innate immunity through the complement system. It is also causes the cell mediated immunity. It also enhances the immune response to in deficient individuals. Of course, vitamin C improves the iron absorption. If you see the iron metabolism, we always tell that you take some citrus fruit or some juice, and it always there is an effective iron absorption. It also has got a role in immune system due to significant antioxidant action. Okay, so always we call vitamin C, vitamin A, these are the antioxidants. Vitamin D also has got a central role of immunity. So I'll not go into the immunity part of these various essential micronutrients. B complex and folic acid are all essential in pregnancy. They play a central role again in the immune integrity, especially vitamin B6 and B12 and folic acid. They improve the cell mediated immunity. So these are the requirements which are recommended daily allowances. Pregnancy, there is increase by some amount. Remember that iodine is in micrograms and selenium is also in the micrograms. Otherwise, they are available. We have already talked of zinc, so I'll not go on talking about zinc and how it helps. The requirement is around 12 milligram. And literature also suggests the beneficial effect of maternal zinc supplementation. See, it causes effect on the infant growth and developmental parameters, neonatal immune system, and also prevents infectious disease, again through the immune response. There are various studies which are available, and they say that zinc supplementation also reduces the 14% of the reduction in preterm deliveries in this study, and increase in the birth weight in underweight and zinc deficient women. There is no adverse effect on the iron supplementation, and this is very important study. About the copper, nowadays there is always we drink from the copper vessels, right? So it is very important in connective tissue formation and metabolism. Melatonin, which is very important. Melatonin production is helped by copper, cardiac function, immune function, and it is an essential cofactor for the antioxidant enzymes like copper, zinc, superoxide, dismutase. So it is always helpful to know about the copper, and copper is also available from the dietary source. Remember this: shellfish, nuts, seeds, legumes, liver, and organ meat. So non-veg, from we get this copper, and this is very interesting. Important role of copper in pregnancy for the formation of various enzymatic processes, as we have already studied. And lower plasma concentration of copper was found in the cases of spontaneous abortion, threatened abortion, missed abortion, and blighted ovum. So this is very sensitive indicator in certain pathological condition, and maybe further possible course of pregnancy and placental function. So serum copper decrease leads to a reduction of elastin and collagen, resulting in premature rupture of membrane. So this is one study that they found out that if the serum copper is less, there is increased chances of premature rupture of membrane because of reduction of elastin and collagen. Now the manganese is another mothering nutrient. It also helps in the bone formation, proteins, energy metabolism, metabolic regulation, and as a cofactor of number of enzymatic reaction. So manganese has got various dietary sources, and again, it helps in the regulation of cellular energy. Magnesium. We always get during pregnancy, the patient always complain of restless leg syndrome. And then we supplement these women with the magnesium. And we find that this deficiency also is associated with preeclampsia, preterm deliveries, low birth weight babies, and increased neonatal mortality and morbidity. And if we supplement, there are various trials which are in association with pure maternal hospitalization, reduction of preterm deliveries, less in growth restricted babies, and also the NICU admissions are less with the magnesium supplement. So that is it. Iodine is very important. We all know we have always received iodized salt on our table. It has been found that iodine is another important cause for and deficiency can lead to abortion, stillbirth, congenital anomalies, neurological cretinism, mental deficiency, and deafness and cretin babies. So recommended daily diet, we all know that it is 220, and we also should know about the good source of iodine apart from our table salt, right? Spinach, strawberry, broccoli, these are the good sources of iodine. So in general population, we know that how iodine is important. So hypothyroidism, goiter in pregnancy, abortion, stillbirth, and it is very, very important that iodine should be properly given to this pregnant woman, as it leads to the neuropsychological problems in the fetal health, brain damage, mental retardation, psychomotor defects, which are very important complications of these iodine deficiencies. So additional iodine supplementation should be given. And why it is increase in pregnancy iodine requirement? Because increase first is the metabolism is different. So there is a transfer of T4 and iodides from mother to fetus, and greater than the normal iodide loss through the kidneys due to increased renal clearance. And pregnant women are very sensitive to iodine deficiencies. So I'll not go into the thyroid metabolism, what happens in various disorders, we know that. We should always tell about these. I have put some colorful picture for you, the zinc rich food and iodine rich food. To know, we used to get these pictures during our school times, and really I'm very happy to tell you that we are in process from with PHFI. We are going to include these various nutrients, nutritional requirements, and the nutritional checklist through PHFI. We are going to launch the curriculum for the training of general OBGYNs and others. So what does our International Federation of Gynec Obstetrics, FIGO, says? That even with the use of iodized salt, what we are eating, a woman's daily iodine intake would be in order to around 100 to 150 micrograms, approximately half the amount recently which is recommended during pregnancy. So additional supplementation should be given of this iodine. Now, selenium, much is talked by Dr. Tiveskar, so I'll just skip some of the slides of selenium. And the daily intake for the pregnant woman is 65 micrograms per day. And these are various selenium-rich foods also. Calcium is a very important molecule, one should know. It is very important to have calcium throughout our life for the womanhood. It is required for the skeletal, neuromuscular, and cardiac function. The calcium requirement is around 1200 milligram per day. And for the prevention of osteoporosis, it should start very early, means from the adolescent itself. So we get ample of calcium through our milk, and additional supplementation during pregnancy we give through various calcium tablets. So apart from milk and yogurt, even we have various other sources like cheese, turnip, sesame seeds is very good source of calcium, almonds, and even cinnamon. So about the vitamin D supplementation, why it has become so important? Even NICE guidelines says that all women are at a greater risk of vitamin D deficiency, because we have, even though we have got so much sunshine, we don't get at the proper time, and the exposure is very limited. Most of the women are housebound, and those who are out, they are predominantly covered when they are outdoor. And our diet is very deficient in vitamin D. We don't eat fish and eggs. And when the pre-pregnancy BMI itself is more than 30, that if the woman is very obese, then definitely they are vitamin D deficient. And some of the ethnicity, when we talk of South Asian, Middle Eastern, African, Caribbean, these women are very, very deficient in vitamin D. And in recent studies in India also, even though there is lot of sunlight, we have found that most of the Indian women are vitamin D deficient. When we supplement the various calcium, I'll not go into the various molecules which are available, or various tablets which are combination of calcium are available. Calcium carbonate has got highest calcium, higher bioavailability, it is economical and safe. And vitamin D optimal serum level should be at least 20 nanogram per ml, they say. So the combinations of calcium and vitamin D3 are available, and better at a time we should not take more than 500 for better absorption, and better to take calcium in the night. So these are the calcium rich foods, and there are various guidelines which are available for the vitamin D supplementation, like ACOG committee opinion. There is no recommendation for the screening of all pregnant women, and if there is of course there is increased risk, vitamin D level should, and if there is a deficiency, then even you can give up to 1000 to 2000 international units per day safe, and higher dosages have not been studied. And even WHO says that in case of deficiency, 200 international units per day alone with the or with the multiple micronutrients. NICE and NHS says that inform all women about the importance of vitamin D and they can make the informed choice. So basically, you should minimum you should take is the 400 international units per day. So these are the vitamin rich foods, and vitamin C is again an antioxidant, and it is very important for the absorption of not only in iron and various enzymatic processes. Then it also has got effect. It guards the body. What I should say that against the free radicals. And combined with other factors, deficiency of vitamin C is thought to result in difficult labor, but has not been established. Okay, so recommended daily intake is vitamin C 60 milligram per day, but in COVID we are taking 500 milligram per day for to combat the various stress. And a good source of vitamin C's are, we know all, that citrus fruits, strawberry, papaya, and the best one is the guava. We know about the amlas and cabbage. They are also richest source of vitamin C. Okay. So requirement I have already told. Vitamin B, I'll not go into the various vitamin B complexes. We all know. Out of this, we should know about the folic acid and vitamin B6, which is commonly used during pregnancy to combat uh, morning sickness. So vitamin B6 is very important, and the folic acid. Of course, the other vitamin deficiencies lead to various disorders. So we should know which vitamin causes what deficiency. Okay, so we treat the peripheral neuropathies, and when there is excessive vomitings and patient goes hyperemesis occurs, and patient may develop pernicious cause encephalopathy. So these are the important things we must know about the vitamins and various micronutrients and the deficiency causes. This is about the folic acid. I'll not go into the details, but it is additionally, we should know that it is also essential for the erythropoiesis and the leukopoiesis. And we know that the megaloblastic anemia, which it causes. So it is very essential for the DNA synthesis. An important thing is cooking destroys the folic acid. So megaloblastic anemia is the most common deficient disorder of folic acid. So 400 microgram of folic acid is recommended 2 months before trying for the pregnancy. So preconceptionally, and it should continue till 12 weeks. These are the folic acid rich food. Vitamin A, we have already discussed, Dr. Tireskar has discussed, so I'll not go into the details, but always remember that vitamin A in excess in first trimester should be avoided because it is known to cause birth defects. But adequacy is required later, and that is retinol around 800 micrograms, beta carotene 6,400 microgram per day. So breast milk is always a good source of vitamin A. So vitamin A supplementation increases hemoglobin concentration of in marginally deficient maternal population. So this is the importance of vitamin A. It is one of the important antioxidant. So these are the vitamin A rich products. Vitamin E is another antioxidant, and it vitamin E deficiency leads to peripheral neuropathy, then ataxia, skeletal myopathy, and pigmented retinopathy. So these are the vitamin E deficiency disorders, and higher intake of vitamin E has been found to be associated with decrease in the cardiovascular risk. So luteins, vitamin E, and even diabetic complications are treated with higher vitamin E. And these are the vitamin E sources like olive oil, coconut oil, sunflower oil, broccolis, almonds, and peanuts. Iron is the most important molecule in this one micronutrient and mineral, I should say. And it is, we know that the lack of iron results in various disorders, including anemia. Iron deficiency anemia is the most common cause of anemia, and it is the most common cause of maternal mortality and morbidity. And it leads to preterm deliveries and other complications. It is required from conception throughout pregnancy, during lactation, throughout womanhood. And during lactation also it can lead to, we know that iron deficiency anemia leads to the neurocognitive disorders in the infants. So recommended daily dosage, one should know that it is 35 milligram per day. And these are the various important sources of iron we know: green leafy vegetables, eggs, red meat, cereals, legumes, dry fruits, broccoli, and mustard leaves. So, especially one should consume whenever we are supplementing the iron tablets. We all know that iron deficiency anemia we treat with various iron tablets, and these should be consumed especially on the empty stomach. It should not be consumed with tea. And we should try to increase the dietary, because what happens usually we start treating the iron deficiency anemia, and one must know the iron metabolism. For that, proteins are also required. So your food, if it is deficient with other requirements, then definitely this is not it becomes a non-treatable condition. So it is essential for the synthesis of hemoglobin and myoglobin. So myoglobin is also important thing, and non-heme iron enzymes. Okay. So these are the various iron-rich foods. And I have come to the last point of my talk, that is, what are the requirements of these nutrients. So whatever the quantities of nutrients that a healthy individual must obtain from food, it should meet the physiological needs. It should not be very in excess, or it should not be very deficient. So that's why this RDA has come. So what is RDA? It is an estimate of nutrient to be consumed daily to ensure the requirement of all individuals in a given population. So first we have to ascertain that the deficiency, the requirement, and how much to be prescribed. So it all depends on the bioavailability of the nutrients from the given diet, which indicates that what is absorbed and what is utilized in the body. So milk contents, if you have to give calcium, 1 liter of milk will give only 1 gram, and that too we should consider how much is the quality of the milk. So RDA also include the margin of safety. That is very important. So these RDAs are suggested for the physiological groups such as infants, preschooler, children, adolescent, pregnant, lactating women, adult men and women, considering their physical activity. So these RDAs are different for different, and you can just visit the ICMR. ICMR has upgraded its RDAs recently in 2020. So you can visit RDA requirement for the from of all the micronutrients and everything from ICMR website. So this is our FIGO's recommendation. What are the daily requirement? What are the various nutrients, and how it is increased in the pregnancy lactation based on the IOM, that is Institute of Medicine recommendation, dietary allowance, and adequate intake guidelines. So in a nutshell, here you can see what is the requirement pre-pregnancy, during pregnancy, lactation, and what is the function. Like if you take the protein, what is the function, what is the food source, and what is the risk factor for the deficiency consideration for the supplementation. So from the macronutrients like proteins, fats, carbohydrates, then comes the micronutrients. So what the deficiency of the folic acid occurs, what happens, what is their function, what are the food sources, everything I have given here in these 2-3 slides. So you can just go through that. Now, what are the WHO global targets? One should know 2025 for improvement of the maternal, infant, and young child nutrition. So there should, what WHO aims is the reduction of 50% of the anemia in women of reproductive age. Secondly, reduction by 30% of low birth weight of babies, and increase in the rate of exclusive breastfeeding in the first 6 months up to at least 50%. Reduction of 40% of the number of children under 5 of age who are stunted, and no increase in the childhood overweight. Now 22% of Indian population, if you see, they're overweight in the childhood. Reduction in the childhood wasting to less than 5%. So malnutrition is not only stunting, but it is also obesity. Now, eat right and eat fortified. So how to tackle this micronutrient deficiencies by other means, not only by tablets and other supplements. You get the vitamin A and vitamin D fortified milk. Secondly, double fortified iron and iodine salt. Wheat can be fortified with iron, folic acid, and vitamin B12. Rice, iron, folic acid, and vitamin B12. And oil, we know that it is fortified by vitamin A and vitamin D. So just remember this chart in COVID. So we should have a physical activity, balanced diet, calcium for bone strength, eat proper dietary fiber, proteins like eggs, take less fatty foods, eat as much as green leafy vegetables, ensure hygiene, then iron and iodine in proper proportion, avoid no to junk foods, avoid protein energy malnutrition in the children, eat legumes which are low glycemic and good source of proteins, milk and millets which are full of nutrients, nuts which are very rich in proteins have plenty, control the obesity, eat protein rich food, quit bad habits. Riboflavin again one of the big complex, it controls the infection. Eat salt in moderation, prefer traditional food. Our traditional food is a cultural food and it has got what we call it as a four square meal. No, it has got proper proportion of all the nutrients. Unite for health, V for vitamins, drink plenty of water, exercise regularly, do yoga for the stress management, and zinc for the better immunity. So this is what one should follow. And this, I just want to inform you, this is very important slide. There is a nutrition information communication education, that is a nice portal. Just visit this nice portal sometimes. It has got everything. You can download through the mobile app. It has got various languages. In various languages it is available. There is a counting app also, how much you are eating daily, count what you have. There is a nutrition atlas which I have just downloaded, that ABCD. There is even book in braille lipi for the blind, they can have. There are nutrition games for your children so that they know what is correct nutrition. And there are various videos which you can play for your patients. So even I appreciate our Ayurveda. According to various rutus, we change our foods and food habits. Pancha Mahabhuta, what they say, and Tridosha relationship. So this is very important. One should learn, and we should have amalgamation of all the pathies. So one, we cannot treat everything with the allopathy and naturopathy or Ayurvedic. So they say that kapha, pitta, vata, and they have various modalities of treatment. And one should have also government's policy and advocacy. Always we blame China for their Wuhan and at Wuhan place and the COVID, but China is very clever. They have raised their nutritional requirement of pregnant women by the policy level. They have made the following suggestions, like hospitals should offer the OPD pregnancy nutrition surveillance. So FIGO is also telling that there is a nutrition checklist, and even we are bringing out some nutrition checklist, so that early nutrition intervention in pregnancy, personalized nutrition therapy can be optimized through diets. And these hospitals, they usually conduct the pregnancy nutrition surveillance. Extensive nutrition and health education should be offered through the hospitals and communities. They have fetal university, moms classes, mummies kitchens, and they provide the adequate nutrition. So to bring out the next generation healthy and to prevent the transgenerational uh, progression of various non-communicable diseases. So always plan the healthy meals. You should have a smart choices. Eat a variety of green leafy vegetables by any means. And at the end, I must say that various cohort-based studies, they suggest the use of multivitamins and minerals during pregnancy. They may significantly reduce the risk of development of preeclampsia, preterm deliveries, improve the pregnancy outcome, and daily supplementation throughout pregnancy may be required by this multivitamin preparation, and they might be important or cost effective, but you should always take into account the nutritional what nutrition they can take, what is their socio-economic status, how much they can afford, and how much you can treat that. So sometimes they might be suboptimal trace element index also. So these are the various micronutrients like selenium and zinc. We always talk of vitamin A, B complexes, C, D, E, folate. They always have been found to improve the immune function, and they reduce the placental oxidative stress and consider the important in supporting the maternal system to deal with the physiological stress of pregnancy through the modulation of maternal and fetal metabolism, reduction in the inflammation, and support the placenta. This is not only during pregnancy. At each step of womanhood, we have different challenges to face about her nutrition and nutritional intervention about her the disease process or even being healthy. So this is the conclusion. I must say that various micronutrient deficiency, they are linked to it not only in the pregnancy, also in the perimenopause, menopausal age, or even in the adolescent. This is what we did in the 2000, means last year. We released a nutrition practice points. You can see it, Science Integra again supporting us through this beautiful. We conducted live and we released this booklet. This is available on our Foxy website. So, doctor of the future will give no medicine, but will interest his patient in the care of human frame, in diet, and in the cause and prevention of disease. That's what Thomas Edison says. So we need not prescribe the medicine. We should advise or promptly tell our woman how to bring up even in the cooking process, how to preserve the nutrients, what are the nutrients, proper nutrients available in that food, the checklist, and this is what I want to conclude with this. So 9 months are the windows of opportunity. So prevention, in order to be truly preventive, must be antenatal, through which that is we can prevent many diseases. And even we should start in our consultation. We cannot afford to have every time to send our woman to any nutritionist or nutritional consultant or anything. We have to spend 15 minutes about what that woman eats, what is in on her plate, how she cooks, what is her socioeconomic status, what is the availability of the nutrients at her place, and accordingly we should come to conclusion what we should prescribe to her, what she is deficient. We should be giving some more time on this, and that will be definitely we will be preventing many macronutritional various deficiencies and various diseases. Thank you very much for the patient hearing. Thank you.
Thank you so much, Dr. Vidya, for enlightening us and highlighting each and every micronutrients and its recommended dietary allowance. And other than that, every aspect which you have highlighted in the health of the population of India. So it was basically a very much thought-provoking session. So, ma'am, I would just like to go ahead with a little bit of few number of questions which we have from the audience. Hello. Vidya ma'am, am I audible?
Yes, I'm audible, but I have one emergency. So you can give some, we can address few of the questions, or remaining, if they can mail me, I can put my mail here.
No problem at all, ma'am. It is just a very short number of questions only, which
No, that much I will address. If there are more than 10, then it will be difficult.
No, ma'am, that's not a problem, ma'am. I'll have a very
I can answer through my mobile also. No problem.
Definitely. So,
and this is my mobile. Okay, I will be putting here.
Okay, no problem. No issues, ma'am.
Yeah. Tell me.
Going on with the first question, ma'am, I have a question from Dr. Mayur. So he has said that since in the modern day population, people are deficient of proper nutrients. So he has highlighted one aspect, that how important is vitamin C supplementation is necessary for proper effectiveness during the COVID vaccination time.
Can you repeat the question, please?
Yes, ma'am. I'll repeat once again. So he has said that during the modern day, in the modern day population, we see that not every person is having the proper nutrients in their food habits, in their daily food habits.
Yeah, I know.
Yeah. So for that, ma'am, how important and in how much concentration do you think is vitamin C supplementation is required for COVID-19 for increasing the
Yeah.
COVID-19?
See, vitamin C, no citrus fruits and everything may not be available at your doorstep. For
Yes.
that, we have got supplementation in the tabular form. We can give the vitamin C, like the various. So medicines in the form of vitamin C, like Limcy, these are available, no? So that can be prescribed to the patient.
Okay.
Yeah.
Okay. So, ma'am, since you have also mentioned, going on to the next question, I have Dr. Sheetal, who has actually asked the question that since you have mentioned trace elements like selenium, so how important is actually trace elements like selenium, since they have a lot of positive effects in the human body. So, how important is the supplementation not only for the COVID but also for the all-round development of men as well as women, and can it be given to all men and women of all ages?
Men and women of all ages, selenium can be given, but I am telling you, it is in the micrograms.
Yes,
Like
yes.
in male infertility, we do give this selenium, right? And selenium is also given in premenstrual syndrome.
Okay.
Like PMS patients, we are giving selenium. And even selenium is given in the female infertility patients. So they are also available in the combination form. They are available in the combinations. So we can give this selenium in the minute forms in patients of male infertility, female infertility, even in some of the patients of fetal growth restriction. They have found that they are very useful. Yes.
Okay, so my penultimate question to you, ma'am, that is, since the elder population is very much prone to falling to a lot of diseases, so how does specifically isoflavones and lutein esters, like these type of elements, help in preventing the common geriatric diseases?
Every patient we cannot give the hormone therapy.
Okay.
So these isoflavones and other these definitely help in means estrogen. What we feel is in postmenopausal women they are estrogen deficient. These isoflavones they definitely help in these prevention of various postmenopausal symptoms. Like I have given this in cases of hot flashes, and there is a recurrent urinary tract infections. So in these patients, this effect of these isoflavones is seen. So isoflavones are very useful in that matter. So they are phytoestrogens, and they are type of a phytoestrogens, and even soybean flour you can mix, and these are very helpful as a nutrient part. Yeah.
Okay, so one of my last questions, ma'am, that is, I have a question from Dr. Nandita from Bangalore. She has asked that how, since you have spoken about star flower oil and evening primrose oil, how important is GLA that is extracted from these two sources? These are, and along with that, how important is essential fatty acids is necessary for improving the general wellness in women?
Yes. This GLA, that is a gamma linolenic acid for the condition like arthritis, even nerve damage during diabetes, and they have even used for the eczema, high blood pressures. In these patients, and it is a one type of essential, it is usually produced from, in the body from the linoleic acid. So linoleic acid is an essential fatty acid. So
Yeah.
it comes through the omega-6 fatty acids.
Yeah.
So it is very useful in PMS. So it is a one essential fatty acid, and it is very useful. And it is this is anti-inflammatory omega-6 fatty acid, what I must say. So actually, you should avoid the greater doses of GLA more than 3,000 per day. So even high levels of GLA should not use. And lower dosage, definitely they are used, and they are very useful in as they are used in various types of arthritis, and even in the PMS. It is a type of omega-6, but I don't have much research on this gamma GLA, what I must say.
Okay.
Yeah.
No problem regarding that, ma'am. So, concluding with that, ma'am.
If anybody has got good scientific evidence for the use of this GLA, please, I also want to know about more about it.
Definitely, sure, ma'am. Even if we get any insights from our end, we will definitely share it down with you.
Yeah.
Definitely.
Yes.
So concluding the session, ma'am, on behalf of Mayor Vitibiotics, I, Rohan Datta, would actually like to thank Dr. Mangesh Tivaskar and Dr. Vidya Thobi for such an insightful session on the given topics. And I would also like to thank all the delegates for attending and being a active part of this webinar. And it was a great honor for me as a moderator in this session to host this session. And I would also thank Mayor Vitibiotics for arranging such a wonderful and informative session with all the doctors present in the webinar. Thank you so much, madam. And thank you.
Thank you very much. Thank you very much. And I thank Mayor as well as Science Integra for the support. I thank Mayor Vitabiotics. And I definitely have, you were talking about GLA, but I have many good studies on omega-3 fatty acid, not of omega-6. I've used for this preterm deliveries for prevention that I must share here. Thank you very much once again, and looking forward for the many more. Thank you.
Thank you so much, ma'am. Thank you so much, everybody present in this forum. Thank you.